Okay, so good evening. My name's Billy. I'm a student. I'm a pharmacy student in Southwestern, and with me here is my interviewee, and I'll let him introduce himself.
Okay, hi, this is Vincent. I'm Italian, living in the Philippines since 8 years.
Okay, so today's question is very simple. I'd like to ask you if what you know about clinical pharmacist.
Clinical pharmacist, I don't know much about it because I never been recovering in any hospital, never.
Okay.
That's not good, never know. About clinical pharmacy, I mean I don't know, regarding medicine, this year for example I took 3 times an antibiotic course, an antibiotic therapy.
Okay.
3 times because I got twice an infection on my foot and legs, and then 1 in my lungs. So.
Okay. So basically, clinical pharmacists are people. They are specialists who work hand in hand with physicians and other healthcare professions to ensure that the medications prescribed to the patient brings out the best possible outcome. For example, if a physician prescribes a certain medication to a certain patient, a clinical pharmacist comes in and he ensures that medication has the best, or rather produces the best possible outcome for the patient, the said patient.
I understand.
Yeah, so basically I hope that's just something, a rough idea about the clinical pharmacist, and maybe that's all. Yeah.
That never happened to me because again I never been hospitalized, and all the medicine in Italy is the family doctor.
Oh, okay.
It's giving you, so
Okay.
we trust the family doctor.
Yeah.
That's it.
Yeah.
Here in the Philippines, I have the as well some family doctor here, and she prescribes medicine to me, and I could just go to buy it. That's it.
Okay. Yeah, so the clinical pharmacists, they also work directly with the patient. Yeah, they ensure they just check the effects of a certain medicine to that patient, and then they advise on the next step, or what to do next.
Okay.
Yeah, so basically that's it, and thank you for coming for the interview.
Okay.
Yeah,
Thank you.
and that's all. Okay, so good evening. My name's Billie KAIYONI. I'm a pharmacy student in Southwestern, and with me here is my interviewee, and I'll let her introduce herself.
My name is Meda, and I study at Southwestern University.
Okay, so Meda, what course are you taking?
Nursing. I take nursing.
Okay, so today's question is really simple. What do you know about clinical pharmacists?
I think clinical pharmacists are those pharmacists or the people who prescribe medicines in the clinic.
Okay, so basically, clinical pharmacists are these are specialists who work hand in hand with doctors and other healthcare professions to ensure the medications prescribed to the patient provide the best possible outcome, and they deal directly with patients, and they make sure like the medications, for example, if a physician prescribes a certain medicine to a patient, these clinical pharmacist comes in that place so that he ensures that the medication has the best possible outcome for the patient. So I hope you learned one thing or two about that. Yeah, so thank you for accepting the interview. Good evening.
Hello, good evening.
Yeah, so my name is Billie. I'm a pharmacy student, Southwestern, and this is my interviewee. I'll let him introduce himself.
My name is Abraham. I'm a medical student from Southwestern.
Yeah, so Abraham, my question today is what do you know about clinical pharmacists?
I think clinical pharmacists are specialists that guide patients on how to take their prescription to avoid overdosing of drugs and also to help them prevent body reaction to drugs. Yeah, they guide them not to avoid those reactions. Thank you.
Yeah, so basically, in addition to what you said, clinical pharmacists are people, they are specialists who work hand in hand with physicians and other healthcare professions to ensure that patients receive medication and also to make sure that the medication prescribed to the patients provide the best possible outcome. So that's it. That's basically a rough idea about clinical pharmacists.
Okay.
Yeah. So
Thank you so much for that wonderful explanation. I appreciate it.
anytime.
Thank you.